The Elliot Health System is committed to delivering the highest possible quality patient care. And we expect to do this in an environment of open communication, where all members of the care team involved in a patient's procedure communicate effectively. This includes the performing surgeon, the anesthesia provider, nursing, and technical support. In fact, this is what our patients expect of us. They expect that we will engage, address all concerns, and answer all questions to ensure their best possible outcome. The Team Steps approach you're about to see in this video was constructed by your peers, and it serves to create a process that engages all members of the care team maximally so that they can contribute effectively, and also puts in hard stops that effectively eliminate possibilities for error. At the core of this delivery model is open, timely, and clear communication amongst professionals. This is the standard for the Elliot Health System.
Okay, is everybody all set? We'd like to do the timeout, if I can have everybody's attention, please. So I'd like to go through, and I'll introduce myself and ask everybody as we go around to introduce themselves and their role as we go through the timeout checklist. So I'm Dr. Mary Lee Soul. I am doing an ORIF of the right radius on Roxy Cameron. Her date of birth is 7/4/69. That's what's on the consent. And
Confirmed on her name band.
And I do not expect that we'll have any specimens or cultures. The site is marked with my initials.
I'm Laura. I'm the circulator. Mrs. Cameron has no known drug allergies. She received Ansep 1 gram at 12:35. Her SCDs are on and functioning. She is covered with lead and an X-ray collar. Her tourniquet is on and set at 250.
I'm Kathy Hunt, the anesthesiologist for this case. I confirm she has no allergies and she did get her antibiotic, and I have no anesthetic concerns. The only other thing I would like to add is that we be sure that we have all safety concerns taken care of. And as far as any concerns about fire, we have a fire extinguisher in the room. And do we have normal saline on the field, Kim?
Yes, I do.
Thank you.
Thank you.
Hi, I'm Kim. I'm the script tech. For your case today, I have the Stryker distal radius set, as well as the Stryker drill system. Is that good?
Handheld, or is it corded?
Handheld.
Perfect.
Great.
Do you have anything on the field?
No, I have no antibiotic or no local.
So Laura, if you could get Kim 10 mLs of 0.5% plain Marcaine, so I can inject that as a local at the end of the field.
Okay, so I will prepare 0.5% Marcaine plain, 10 mLs for at the end of the case.
Perfect. Great.
I'm Brianna. I'm the X-ray tech. I'm confirming we're doing a right wrist. The patient is not pregnant. Everyone is wearing lead, and we have films on the view box.
Perfect. Okay, as always, if there's any problems or things that impact this patient's safety, please bring it to my attention. You can yell hard stop if you need to. Are we ready?
Yes.
Ready?
Okay, let's go. Let's mark this.
Okay, counts are correct.
Okay, good. Why don't we spread our sign out now? Can you show me the sign out list? Okay, so we did an open reduction internal fixation of the right wrist with bone grafting. Our EBL was probably less than 10 mLs because the tourniquet's still up, correct? I don't expect there to be any complications. We'll put the Marcaine in after we close. Laura, do you have the cast cart here for the splinting, please?
I do.
And you can look back, you know that she'll need a sling.
Okay.
I don't have any specimens. I'd like to start the debrief, and let's do it in the order of having Kim, then Laura, then Dr. Hunt, and myself. So Kim.
Well, I think the case went really well. It was really good that once you get in there, you realize that the fracture was a lot worse than you anticipated, and you asked for the bone chips. So we had those, got those in the room, so we had an allograft here on site, and we're able to use it.
Good. Very good.
I think everything went well. The communication was excellent. I think that working as a team, we were able to avoid any complications, and everything turned out well.
And the patient did fine as far as the anesthesia goes. She did very well, and I'd just like to thank Kim and Laura. I'm still relatively new here, and they do so much to help me get the case started, and I really appreciate it.
You're welcome.
So I think things went very well. I do want to commend Bree for making a quick entrance when we called her at the last minute to be able to come up with the x-ray, so that was very well. I feel like we did a good job here in terms of keeping the patient safe and communicating very effectively. Thank you very much. I hope you enjoyed our video about team steps and got out of it as much as I did from this in the safety initiative that the Elliot Hospital is putting forth. I was a little bit of a critic when it first came out, but I've come to really embrace the process because this is something that makes it very easy for everybody to be on the same team to take care of the patient for the ultimate goal, which is to have a safe outcome. I've practiced medicine all my life thinking about what it would be like if I was the patient or this was my family member. And this process makes me feel very comfortable that we produce the absolute best and safest outcome for all of our patients. It allows all of the members who help me to provide care for the patient to be on the same page and look out for the patient's safety. It's very easy to do. Even after just a few weeks, we have very comfortable run-throughs. It does not take very much time, and I think it's also very important for the physician to be the one who leads the charge. So please join me and the rest of the Elliot Hospital team in engaging with Team Steps. It's a great process. Our team loves it. Our patients have great outcomes, and I think you'll find it easy and affirming, something that you should embrace as I have.